Okay. Well, let's call this meeting to order of the El Paso County Public Health Board of Health for October 27th, 2021. And of course, the first thing we do is a board member roll call. And it looks like we got quite a few in person here today. So Commissioner Bremer?
Here.
Commissioner Gonzalez?
Here.
Councilmember Donaldson?
Here.
Barry Kilroy?
Here.
George Ralston?
Here.
Dr. Richard Vu? I'm sorry. I'm here. Fire Chief Ted Colas. And let's see. Sam, are you out there? Can you raise your hand? Councilmember Sam Geek. Have you signed in? Not yet. Okay. Well, we'll maybe when Councilmember Geek shows up, you can give us a heads up, Vicki. Okay. So just some notes today. Diana May will be our county attorney. Kelsey will be running the slides. Jared is our public information and IT support. Melissa Seidenberg. Is that a new face? We'll be taking, oh, really? Okay. We'll be taking notes. And Vicki, of course, will be monitoring the chat and hand raising and all that. And we do want to pay to the screen. So if someone outside this room has a comment or wants to speak, then there you are. Okay. Good. First action item is approval of the agenda. So you have it there in front of you. Questions, comments? If not, I would entertain a motion to approve.
Okay.
Second?
Second.
Okay, all in favor?
Aye.
Okay, well, we have a jam-packed Board of Health meeting today, but I really like hearing from the other board members. And what I'd like to do is start off with some comments from Commissioner Cammie Bremer. I think I don't know if you have prepared remarks or you're going to do this kind of a cappella, but
I will.
Commissioner Bremer.
I am somewhat prepared, but I will just speak from the heart and off the cuff a little bit here. I understand that the proclamation that our Board of County Commissioners, which is a distinctly different body than this Board of Health, that a resolution we passed about a week and a half ago caught some by surprise, and that the headlines, given that we're not, to be honest with you, not entirely accurate of all of the very thoughtful wording that went into a proclamation and a resolution. So I brought copies of that with me today, hoping that our Board of Health will take the time. I'm not going to read through all of it unless you'd like it read into this record too.
No, that's fine. I think that you just touch on the parts that we talked about.
I want to touch on, you know, when I say it was a very thoughtful, approach to really your commissioners standing up against 100% mandates, not at all standing up against vaccinations. And in fact, there is a whereas paragraph. The Colorado Hospital Association and the Colorado Healthcare Association both believe that achieving 100% vaccination rates among healthcare workers is unrealistic and incongruent with similar standards for flu vaccination rates within their industry. And what we were proposing, and what I understand the Hospital Association has proposed, and that we are all in agreement with, is that 90% is an attainable rate. And really, I just wanted my fellow Board of Health members to know that that I, as a board member, I am not against at all anything that public health stands for. We are about prevention. We are all about the vaccines that we know are making a difference and do work. And in fact, the last paragraph of this also specifically says we encourage citizens to thoughtfully consider a range of COVID-19 prevention strategies, along with their personal medical situation and religious beliefs, including hand washing, social distancing, staying home when sick, and receiving the vaccine. That was specifically said. So I guess I just wanted to clarify the scope of this particular proclamation being about really, let's be reasonable. I think our El Paso County in general has been reasonable up to this point in making sure that citizens have the ability to decide for themselves. And I think that's personally parallel with businesses deciding for themselves how they want to run it, including our medical providers and hospitals. And I actually said that as well as we were. We had a couple of meetings where we had many nurses show up and voice their opinions strongly to us. And I pointed out that, all along what your county commissioners have fought for is your freedom and your ability to make the decisions that are best for you, encouraging you to take into account your medical situation, work with your PCP, all of these things that are really tenets of both our healthcare system and of public health. And in doing so, there's quite frankly a little bit of a fallacy for, I'm not going to say at this point, hey, I'm now going to tell you how to run your business. What I am going to do is bring attention to the fact that there's a balance. And I think it was an important thing for us to point out that all of our, that the medical industry in general is struggling to find providers, and that perhaps this is, let's find a reasonable approach that allows those who are trained medical providers to remain in a profession, and a balance for the hospitals to keep their patients safe. So that was the point of this, and I want all of my colleagues here to know that I personally am a strong supporter of our systems, our 3 great systems that we have in El Paso County of medical providers. I will champion you, I will listen to you, and I encourage you to pay attention to carefully crafted words that were intended to strike that balance. And I hope that we did that. And I've heard that many people were surprised by what we did, but I don't think the headlines were exactly accurate for what we actually did. And that was thoughtful.
Okay. Let me make a quick comment before we go ahead and open it up. You led with the fact that the Board of County Commissioners is a very different body than the Board of Health. And we appreciate that. And of course, we more than welcome our participation from our county commissioners. But it is different, and I think in our precepts as we do the roll call, we have to remember that we are science-based, data-driven, and focused on best practices. Our goal is not 90%. Our goal, is a touchdown. So we aim for the top. We want to try and get everybody vaccinated. And again, just to restate the obvious fact, vaccinations are our very best hope for getting out of this pandemic and moving to the transition to the next stage. We also live in the real world, okay? But Tammy, I appreciate the fact that you were sensitive to the fact that other board members were kind of grinding their teeth a little bit over that resolution. So thanks for leading with that. Yes, Kim. Excuse me, sorry.
Thanks, Dr. Turvish. I appreciate the BOCC. I'm glad to live in El Paso County and appreciate all you do. I understand that you're elected officials, and so I'm sure it's very challenging because you can't please all the people all the time, for sure. But you guys dropped the ball on this one. With all due respect, I'm especially surprised at both of you. You've sat here for months listening to public health experts talk to you about this pandemic. And I understand that your proclamation isn't against vaccinations per se. But at this time in the history of our county, of our world, shouldn't all leaders be working towards the same thing? And as Dr. Turbush just said, vaccination is pretty much our one and only tool at this point. And you have some fallacies in your proclamation. If you talk to maybe some other professionals besides the nurses that came to you, one thing I'd like you to know is that with UC Health, of the 26,000 employees, over 26,000 employees in the state, we lost less than 0.5% because they chose either not to get vaccinated or not to apply for an exemption. Your proclamation also insinuates that there are no exemptions, and there are. We gave, I think, 1,100 exemptions for religious or health reasons. The other thing is that before the state even issued their emergency rule, over 85% of UC Health people were vaccinated because we're in healthcare and we believe in the science and the data, and it's the right thing to do for the patients. So it's done. I mean, your proclamation's out there, it's done. So what I would ask my fellow board members, including the two of you, is that the Board of Health would issue a resolution, some sort of statement saying that we support vaccinations, especially for healthcare providers. And while you talk about the 100%, yes, the emergency rule requires 90% to be vaccinated with the flu vaccine. And I don't know why they chose 100% for COVID, but in hospitals, we require 100% of our employees to be vaccinated for the flu and for COVID. Because again, that's the right thing to do for patients and for the staff to keep them safe and healthy. So I've worked for UC Health Memorial First for 10 years, just celebrated my 10-year anniversary. For the first 6 years, I didn't even know we had a morgue, but we do. There's a morgue in the hospital. And in the last year and a half, I've never seen a dead body before, but in the last year and a half, almost every day when I'm going in to the employee entrance through a tunnel, I pass people wheeling a dead body. And of course it's covered. I don't see the body. But for 10 years, I didn't even know we had a morgue. We are averaging 2 to 3 deaths a day from COVID. 85%, this was back in September. I don't have the October stats, but back in September, 85% of the people hospitalized in our hospital with COVID were unvaccinated. 95% of the COVID patients in the ICU, the most critical care, you don't want to be in the ICU. 95% of those patients are unvaccinated. And so you talk about the stress on the staff, that's what's giving stress to the staff. They are caring, because this is what they did, they signed up to be healthcare providers. They are caring for unvaccinated COVID patients. And so when a body like yours sends a message to our community that it's okay not to be vaccinated, you're working directly against the Board of Health and every other group of leaders in our community that's trying. We're all trying to get the same thing, right? We all want the pandemic to end. We want the freedom to go out and do things with our friends and our families, go to concerts, go to plays, movies. I mean, I haven't been to a movie in 2 years. So
you should go to one.
I'm not really sure what that comment means, but that's not the point of what I'm saying, is it? That I should go to a movie. My point is that the science, the facts, and the data tell us that vaccination is the way to end this pandemic. And a body of leaders that tells the public, who listens to leaders, that it's okay not to be vaccinated, and that healthcare workers of all people shouldn't be vaccinated, or it's okay if they're not vaccinated, is against the facts and the data. And this is, as Dr. Turbush said, we're a board that deals with science, facts, and data. The other thing I should point out is I am fully aware that I serve at the pleasure of the BOCC. So I won't be surprised if I am removed from this board. I think that probably wouldn't be a surprise. But it was important to me, as I think I'm the only one here that actually works in a hospital and sees what our staff and our leadership are up against. They're frightened, they're frustrated. We're putting beds in hallways in the emergency room. I mean, this is not what nurses signed up for. They want to heal people. They want to take care of people, and they're watching people die. And there's a pretty easy way, is if all of us got vaccinated, this would slowly end. It's not a government conspiracy. There's not magnetic metal in the vaccine. It doesn't alter your DNA. I mean, all those things are crazy myths out there that we shouldn't be propagating. So that's what, those are the comments I wanted to make. The ask that I would like for this Board of Health, because it's our job to look over, to help the health of the community, to work with prevention. I'm asking this board respectfully if we would please pass a resolution saying that we 100% support vaccines with all the whereases, you know, that it's safe, it's effective, it's gone through rigorous research, et cetera, and that we support healthcare workers to also be vaccinated. Thank you.
Good. Commissioner Gonzalez.
Sure. I respectfully disagree in that your overall concept is inaccurate. We didn't say the vaccines were not something that should be done. What we said is that a universal government mandate is not appropriate. That has nothing to do with the science, has nothing to do with the vaccines. That's a totally separate and independent issue. And I have been consistent from day one that local control is better. If UC Health wants to self-implement that, then let them self-implement. If Penrose Hospital wants to self-implement as a business, let them self-implement. The proclamation, you have described it inaccurately. And so that's my defense to that. I think everybody remembers when Governor Polis, CDPHE, was shortchanging El Paso County on the vaccines, which were saving lives. Who here in this room was the only person almost, fighting to get the vaccines for our residents? Every day for a week, for a month, I was fighting to get vaccines for residents. I don't remember a lot of other people standing up to the state when they were cheating our residents of vaccines. So for somebody to say that we're not fighting for our residents is wrong.
Any more than you are, but punishing Polis by saying that you shouldn't make a government mandate only punishes us and our
It is not punishing
citizens.
Polis to ask for consistency in rule of law.
Well, of course, we can agree to disagree then.
Okay, I agree, but your statements were inaccurate.
My statements
What we
were
did.
fact. My statements were fact.
I'm gonna call an audible here and say that I think vigorous and heartfelt comments from Board of Health members is probably the most important thing we have to do today. And this issue is not only central to the work that we do, that the Health Department does and the Board of Health does, but that it is also very timely. So I would suggest that we go ahead and continue around the room with other Board of Health member comments on this or other topics, but that we sort of do it one at a time. Okay, let's do it that way, because I really want to keep it, on a very high level and very civil. So appreciate the conversation so far. I hope I haven't totally thrown cold water on it, because I, again, think this might be the most important thing we have to do today. So any other board member comments? Yes.
I would just like to, again, thank Susan and her team for all the work that they're doing in this really, I call it a horrible environment to have to be working in today with all that's going on. And knowing that, they're trying to do everything, and there is a limit to what they can do and can't do. And so I just want to say thank you all, because prevention a lot of times doesn't get a lot of recognition, but prevention is what we're all about, and preventing premature deaths, preventing illness, all of that. And my concern is with hospitals, it's not just space or beds, it's staffing. And if I know I have a nurse friend down the street who was was working at Memorial, and she was working in the emergency room, and she resigned because it's just too much. I mean, she's vaccinated and she's seeing all of this. And so that's why, I think that's part of the reason why we have a healthcare shortage, is people are, just like here at the health department, you're overworked and understaffed, and you can only keep that up for so long, and then you have to take care of yourselves. And so I would encourage all of Susan and her team to take care of themselves, because you know, you can't please everybody all the time, and we have to make the best decisions for our population in El Paso County, regardless of affiliation and political affiliation and ideology. I think we have to work within the constraints of what public health really is and embrace that and try and make decisions for the public. And we're not going to please everybody. That's just the way it goes. And I know that if I needed an emergency appendectomy, I want to be able to get one. I don't want to be turned away from a hospital because they don't have staffing or beds or both. And I'm a widow, so obviously I have one son in town, and I have a brother, and it would be, if there was even a bed in Denver or someplace else, or, you know, it's not a good situation. So we need to look at that and make sure that we're doing the best we can to keep our residents here in El Paso County that require hospitalization, whether it's requiring masks, whatever it is. So that's just my piece. Thank you.
Thank you. Yes. Boo.
Can I offer my interpretation of the proclamation?
Yes.
I think in this, on this board, in this room, there is more agreement than there is disagreement. I think we all agree that the vaccine works, is helpful, it saves lives, it decreases stress in the healthcare system. We all agree that the more people vaccinated, the better. Whatever that number is, 90%, 100%, the more people, the better. I think the disagreement, the only disagreement is a small disagreement, and is which level should the mandate be? Should the mandate be at the federal level, the state level, at the county level, or the business level? And I think that we all agree that, yes, if any level, take it back, if people are mandated to get the vaccine, then we will support that. But the proclamation says that that mandate should
Is
not
now
come from the
exiting.
federal or the state level. And the mandate supports the mandate at the business level. And if the business mandates the vaccine, then I believe our board will support that. But the more people getting the vaccine, the better. So I wanted to offer the interpretation of this proclamation and point out the fact that we here agree more than we disagree.
Yeah, Bill. Other Board of Health member comment?
Sure.
Yeah, go ahead.
So first, I want to thank the county commissioners for their proclamation. I know a lot of my constituents appreciated it, and I did too. I think it's important to remember that in America, we don't appoint medical boards to issue diktats and tell people what to do. That we elect elected officials, and they balance various interests. Our health is one interest, our freedom is another interest, and there are other interests. And so we as elected officials try to do that, right? A couple of other examples, we could decrease deaths by lowering speed limits below what they are now. But we strike a balance where we think, hey, we're at a pretty good spot with the speed limits we have. There will be more deaths, but the effect on the economy, the effect on personal convenience isn't worth pushing them down farther. Another is diet. We could reduce diabetes and the stress on our medical
Those
system by
things aren't
regulating.
transmissible, sir. You're talking about things that I can't catch diabetes from someone.
Okay, so
So those
that's
aren't apt
I
descriptions.
think we were going to go one at a time.
No, I got to step in when it's fallacy.
Go ahead.
Will I continue, or will I be corrected when when Ms. Kilgore.
Councilmember Donaldson, please continue.
Okay. So I think those are the kind of things that we try to balance as elected officials. The good of health versus, and not versus, but along with the good of freedom and also not creating significant divisions among our people, where we create an environment where people feel like their government is forcing them to do something which they don't want to do. And perhaps that is get an immunization. And perhaps they have a personal reason for that, which they're willing to accept the risk of COVID in order to exercise that freedom. I don't think it's a 100%. In fact, I know, and you know, it's not unanimous among the medical community that mandatory vaccines should occur. You can watch physicians talk every night on television, so I'm thinking it's not, mandatory vaccines are not a good idea, especially in children, due to their lower risk, right, of consequences from COVID. So I think that's what I want to express, that we don't, another example is I had an alarm system put in my house, and the guy's a friend of mine, actually, and you know, actually I didn't get his alarm system, but he gave an example of, you know, there was a couple here in town that came home to their house, there were criminals in the house, and they were murdered, and he's like, I don't know why anyone wouldn't have an alarm system in their house, right? But the odds of that are pretty small, of that occurring. So lots of people decide not to have alarm systems. To him, because he sees that, or my father, who was in law enforcement, they saw the world as very dangerous, and there are lots of things that can happen out there. A lot of citizens are willing to accept that risk, you know, at a certain level. If you're elderly, everyone here knows the risk factors. If you have pre-existing conditions, you may think, hey, I want the immunization immediately. If you're an extremely healthy young person, or even in, say, my case, my father had dementia, right? He had Alzheimer's. So if it turns out there's a risk from even a slight risk that this may raise the possibility of that, for me, it may not be something I want to do. I've had the shots, so I'm speaking hypothetically. So, and one other thing I would say, the example was given of, I don't want to go to the ER and I need an emergency appendectomy and they send me away. And I think we don't need to use examples that aren't real, because in El Paso County, no one's being sent away from the ER in an emergency situation because of COVID. I don't believe that's happening. If it is, correct me on that. So those are some of my comments.
No, you're correct. We are not sending, of course, we're not sending people away from the emergency room, and I'll let.
But what if we got to that critical point? Then what would your recommendation be? I guess that's my question, is I think we need to look at that.
So that is exactly my point, Doris, is people, and I think Carrie said this.
It's Kari.
I'm sorry, Carly.
Not that either. Kari, rhymes with sorry.
Kari said, hey, 85% of the people who are admitted are unvaccinated. So people are it's a risk they're taking, right? And I think politically in our country, we allow people to take those kind of risks. And that's why we're run by elected officials. Our government is not by health experts or safety experts or other experts who they stay focused on one issue, and that's exactly what they want to deal with. We have elected officials who balance various interests, health being one, but the effect of a forced mandate has on our community by dividing people and driving people into corners and making them less and less likely to get the shots because they feel like it's a freedom issue at this point. If that information gets out there, I believe people will decide, you know what, geez, I guess I need to get the shots because my friend died from COVID.
That's a pretty tough lesson. I wasn't gonna do this, but I'm gonna go ahead and do it anyway. I wrote a letter to the editor of the Gazette this past week and showed it to my wife, and she said, no, you can't send that. But this is the Board of Health. This isn't City Council, and this isn't the Board of County Commissioners. This is the Board of Health. And so I'm gonna go ahead and read this into the record and let the chips fall where they may. I think, though, that it's important to remember what our duty is here in this room around this table. Politics aside, we are learning the wrong lessons from our almost 2-year experience with COVID-19. After 670,000 plus deaths in the U.S. from COVID-19 and an estimated $6 trillion spent by the U.S. government on COVID response, we need to do better next time. As scientists, we can sometimes be accused of claiming to know more than we actually do. The scientific method used in healthcare has been around a long, long time, but sometimes new information becomes available which disputes previous claims. Science is big enough to submit this new information to the same rigorous scrutiny and peer review which has long been established in order to make sure therapies are both safe and effective. A certain humility at the outset is preferred, however, when new data is being considered. We don't know yet what we don't know. The first wrong lesson is that this wasn't so bad and that the cure was worse than the disease. For the many families who have lost loved ones to COVID-19 or been personally affected themselves, you deserve an apology. As physicians, we have seen the struggles of hospitalized patients with COVID-19. We have even heard statements to the effect that this only affects older people, so it's not a concern of mine. While being untrue, it is also shameful. Healthcare workers have done a hero's job of trying to save lives and lessen the burden of COVID-19 infection. In public health, we are already considering the next pandemic and what effect that could have on our healthcare system and our society. There are worse diseases than COVID-19 that we know of already, and we anxiously await another novel disease, which by definition, we don't yet fully understand. A cavalier attitude about a future new disease could have a dramatically worse effect with an unnecessary loss of life and slowed response. The second wrong lesson is the spreading development of an unscientific attitude. Anti-scientific attitude, not unscientific, but anti-scientific in society. There's a genuine lack of trust and skepticism about vaccines and public health guidance in general. Vaccines are still our very best tool for getting past COVID-19 this winter. And with the upcoming COVID-19 vaccine for children 5 to 11 and booster shots for older folks, our options are even better. Messenger RNA, mRNA technology, which was used in the creation of some of the vaccines, is not only safe and effective, but has enormous potential for creating other life-saving therapies. To reject COVID-19 vaccines is not only anti-scientific, it is selfish. Quite frankly, it is difficult to have a civil discussion about the science behind these vaccines or the science behind almost any of the other actions taken to prevent the spread of COVID-19. It only tends to harden already formed opinions. The consequences of this are already known. Further polarization of society, less civility, more anger, and less trust in authorities. Good science gets swept up in this maelstrom and rejected. This in turn costs lives. I finished with, we appreciate the majority of you who have already been vaccinated, who do follow the public health guidance and recommendations and respect science. If current trends continue, COVID-19 will fade from the headlines and become endemic like influenza and mostly seasonal. Human societies have been living with contagious disease outbreaks since the beginning of history and not always very successfully. But with these new tools, we hope to do better next time. I guess I just try and summarize that by saying that for those of us with the scientific background and a lot of schooling behind us, much of the discussion here this morning seemed less important than saving lives. And that's where I'm at. As a Board of Health, our function is saving lives and improving the health of our community. And that's where I'm at. And other discussions, other points may be, in fact, relevant in other venues. But here we're about saving lives, preventing disease, and improving the health of our community. Okay, other Board of Health member comments? Our Chief.
I've been quiet up until now. I really do appreciate you all on the County Commission, City Council. You're sitting at this table and at your other dais. You're in a uniquely stressful situation because there are 70% of your constituents agree with vaccinations, and they've done them in our county. And there's about 30%, a little less than 30% that haven't. You represent all of those people, and that puts you in a really challenging situation in that setting at council and at the Board of County Commissioners. But I agree with Dr. Turbush. At this table, we've got a different challenge, and we need to concentrate on that challenge when we're together and band together for our community's healthcare needs. I appreciate your letter. I'd only begun to read it myself, so thank you for reading it all the way through. And I support it wholeheartedly, and I think that it should be sent to the Gazette. I'll respect your wife.
Yeah, Susan may have a choice on that one. Okay, yes, Commissioner Bremer.
Thank you. I very much appreciate that letter as well, and I think it's spot on. I think much of what Kari said is spot on. I think Dr. Vu gets the eloquence and succinctness award of the day for summarizing exactly. And I guess I just my intent in bringing this up was absolutely not to bring politics into this board. It was actually to address, to make sure that we could have a good discussion about really what the intent is and was. And it was, Dr. Vu said that very well. One of the phrases that was in Dr. Turbush's letter was one of the things that has really hurt the science and public health and the medical profession in all of this is a cavalier attitude towards it. And I brought this up today so that my colleagues on this board would know that this was not done with a cavalier attitude at all. And we do have a lot to balance. And this isn't about one board versus another. Both with tremendously important roles, it is about the public and the public's health. And I've been sitting here looking at that screen the whole time, prevent, promote, protect. And I fully well believe in this organization's wonderful and long track record of doing that. And we're just but a piece of it. And thankfully under wonderful leadership and a diverse board, diverse in thought board. I think that's also a continuous improvement process and part of it all. So my intent was not to have this be a political thing. It was for everybody here to understand that we had a role that we have to do with this, and it does not mean we're taking vaccinations or the health of our community any less seriously. So thank you.
Thank you, Commissioner Bremer. I think perhaps we're at a point of closure with this particular discussion. On the table still is Kari's recommendation that we come up with a resolution from the Board of Health. And I would ask perhaps that you coordinate with Director Whelan and her staff on some draft language that we could look at the next meeting. And then if it looks good, we can take it to the board for a vote. Okay? We have a thank you letter here. This is from City of Fountain. Dear Board of Health, I want to reach out to you and say thank you for all your hard work this year and for the things you are still working on. This past year could never have been predicted, yet you kept moving forward and doing your very best to keep everyone informed and healthy. Thank you, City Council, Fountain Council. Okay, let's, we have something that I love to do is the Board of Health Champion Awards, and we have 2 champions to recognize. Susan, do you want to do that?
Yeah, I'd like to propose, if it's okay with Ted Colas, that we recognize him at another meeting.
Okay.
Because this is, we recognize the homebound operation that, I don't know if you remember, you probably do, but in the policy meeting, you had the great idea of the concept of the homebound program, and we recognized other colleagues with the fire department, with MRC, and some of our staff last time. But in light of just the time, and I do want to get to the executive session and hear the very valuable feedback from board members, and also legal. So if you're okay, could we push that to the next meeting?
Sure, consider me recognized. That's
Well,
The suspense is killing us, but let's wait until our next meeting.
yeah, and so we'll catch that up. But we do have some partners, members of our community that I would like to move forward with a recognition of public health champions, if that's okay. These days and these meetings are such a jam-packed meeting, and they're all priorities, and we want to get to, but thank you for your grace and having us push that back. So let's go ahead and have Leticia Letty Arenada come up, please. And we are recognizing Letty Arenada for her willingness to volunteer at many of the points of dispensing. And you can stand right there.
Welcome.
Thank you for being here. She helped us out at many of the points of dispensing we held at the South Building. Letty first started as a promotora, working with partners in southeastern El Paso County community to hold an equity points of dispensing that was designed specifically with our Spanish-speaking community members. She saw the need to continue to support the pods by providing bilingual services. We even tried to have Letty register with Goodwill Staffing, and that's the way that we're able to pay volunteers. However, with that staffing agency who was supplying, many of our staff members, but she declined and stayed really a true unpaid true volunteer. Her support in our vaccination efforts and to the entire community is so appreciated, and you are a true public health champion. I know that you reached out to our emergency preparedness and response manager, Lisa Powell, to really get involved, and you're caring about the community and helping us with vaccinations. I think it's so important. With what we've learned also is that to have that contact and your trust within your community to be able to support us also in being successful in providing vaccinations. So we want to recognize you as a public champion, and we are so appreciative of you and your time, and we hope to continue keeping in touch and working with you, because we have the 5 to 11-year-olds to vaccinate, and we're gearing up for that the 5th, the 6th, the 7th, and so that's the weekend at the South Building. But thank you so much. And I've seen you, and I know the work that you've done, and our other partners too. I see Lisa here, but you are a true public health champion, so thank you so much. And we're going to take a photo. photo with Board of Health, but I also want to give you an opportunity if you
Yeah.
want to say anything.
¿Quieres decir algo y yo te traduzco?
Sí, solo
I
quiero,
will translate for her,
Okay,
okay?
thank you.
quiero como dar las gracias porque están dando la oportunidad a toda la comunidad hispana a que se acerque a nuestro idioma, ayudarles para que ellos también puedan vacunarse.
I just want to say thank you because you're giving the opportunity for the Latino community to approach public health. And for me, it's a pleasure to help everyone in the Latino community and talk about public health. ¿Qué más?
Y del que hablamos el mismo idioma y que ellos se sienten como con más confianza acercarse cuando uno le habla al mismo lenguaje de ellos.
She really appreciate that you guys think that we speak Spanish, and when in your clinics you bring people who are bilingual, bicultural. She really appreciate this because we're all one.
Lisa, can you stand over there too while you're talking so I can take a photo of you?
Oh, sure, I love taking pictures.
I'm over here too. Notice, and because we've worked a lot with Lisa as well.
Yeah.
And we can't do our work and serve in our community without you. And it's really a true partnership. So, it's a symbiotic relationship. We need you, you need us.
Yes, we all need each other. Amen, sister. But today it's about Leti. I just want to say a little bit about Leti because she's very humble. I'm not. So I like attention somehow. My promotora here, or promotora, you have had for the past 22 years gold in here. You have a team of people that wants to serve. They just didn't know how. So my job as a community leader, as a community advocate, is to get all of them together, see their skills, and then partner public health systems, maybe government systems, bring the community. We all feel safe. We all feel welcome with you guys. Thank you very much. I want my community to know that public health exists and what you guys do and all the work that you guys do. And some of my people don't understand because they just don't speak the language. They have language isolation, status isolation, but having community leaders, government and community leaders together, then we transform communities. And that's what Leti has been doing for the past 20-something years. This woman, we organized a clinic in less than 2 weeks, and we brought more than 1,000 people with you guys to get vaccinated in less than 2 weeks. This lady mobilized communities. Me, I'm just the face of, I don't know. I just love being the face of everything. So I don't know, No, I do a lot of work. I have a lot of passion. I have always been committed for 22 years with my community. So, but today's about Leti.
Thank you.
Yes.
Okay, this is a photo op, and I think, how do you want to organize it?
Could I
Oh,
just
yes,
say
please.
one word? I wanted to just also share that after we had the clinics where we had 1,000 people come, we had to do a second clinic. And one of the most important things that Letty did was she came back and she encouraged those people to come back to our clinic, even though it wasn't all the promotoras there anymore. And then we had about 150 people left on the list who we didn't know whether they had gotten their second vaccine. They didn't come back to our clinic. And Letty took that list and she called every single person on that list, 150 people herself.
Wow.
She called them and encouraged them to come in. Many of them were afraid to come back because they didn't know if they would have someone there to speak their language, or they felt like they had missed their appointment time and they didn't know if they could still come. And she encouraged them to come and get their vaccines. So it was important work. Thank you.
Well done.
Yeah, Leti.
And we're going to be giving her a coin. You and law enforcement or fire know what this is, but emergency preparedness and response. And it's, I believe, a tradition. So then
There you
just
go.
shake your hand.
Just right. There you go.
That's for you. And we'll, you can put it in there, or you can display it wherever you want. And then this is your public health champion.
Oh, thank you.
And we'll go over here and take a photo.
Oh, yes, thank you.
There we go. Okay, photo op. See how you organize this.
We'll have
Okay.
Letty in the middle. Probably move some of this stuff just so it's.
Today, I want to make you
We gotta make this challenge.
No.
You did the work.
Stand in the middle.
And then in the middle? Okay.
No, you're fine. No,
¿Por qué
no.
no?
Today it's all about you, Letty.
Yeah, we'll take a picture later.
Well, it's all about you today, Letty. I take lots of pictures all the time.
Say smile in Spanish.
Smile. Sonrisa.
Okay, we'll take several here.
Sonrían. Sorry. Bonitos todos, guapos. Wow, Letty, you look so wonderful.
I think we're good. Thank you, everyone.
Okay,
Good.
thank you.
Bravo.
Champion. All right.
Okay. I'm like, I take lots of pictures all the time.
Hola, ¿cómo estás?
¿Cómo estás?
Good, good. I read some good stuff about you.
Right? Saving lives, man. That's what I'm doing.
Okay, ready?
Okay. Fire chief, we get you next time.
One more.
Is that the only one?
That's fire chief.
We went off that other topic, so
Okay.
I had.
One more. Ready? One, two.
Did we miss one?
On opioid, no, on the comments, I wanted to comment on the opioid settlement.
Oh,
So is it okay
okay.
to go back?
Well, let's go back. Commissioner Gonzalez has a quick comment about the opioid settlement, which will bring additional monies to our community.
Yes, thank you. So I think it was in the paper today, talking about the state settlement of the opioid crisis and pharmaceuticals. And so I recommend people go and read that. I will compliment the state's attorney general on his negotiations with that. But I did want to highlight one thing specifically. So through this, the negotiations that specifically included El Paso County commissioners, along with, again, the attorney general who led the negotiations on the settlement, resulted in the state of Colorado getting to keep millions more than otherwise would have been utilized for our Colorado and El Paso County residents than if the Board of County Commissioners had not been involved directly in those negotiations. So I'm very proud of our BOC and our staff and public health's efforts in working with the state to negotiate what ended up being millions more for the state so that we can help our residents and those in need and those that have been consumed by addiction, that we can help them. And so I'm very proud of the BOC for our efforts there. Thank you.
Thank you. We do have Councilmember Geek on the line.
Have a good day.
See you. Adios. Well, thank you. And I'd be interested to know how many millions more that is our share when that's divvied up. Okay, well, our next action item is the approval of the minutes, which board members you have in front of you. And any additions, corrections? Otherwise, I'll entertain a motion to approve the minutes.
So moved.
All in favor?
Aye.
Finance and budget. Now, we have both a brief financial summary and then we need to approve 2 contracts. So who's doing that? Is that Lori? Are you on the line, Lori, or Samantha?
This is Samantha Montminy, Budget Supervisor for Health and Human Services. I'll be reviewing these for you
Samantha, I
guys
see
today.
your bubble there. Are you on mute?
Can you guys hear me?
Maybe? We've got some
Can
technical
you guys hear me?
issues going, which is very rare, by the way. Here. Samantha,
Are you guys able to hear
how
me
about
today?
Lori Cleaton?
I can hear her. Can anybody hear me?
We can hear her online, we just can't hear her in the room.
Can you turn up the volume?
Okay. And
Are
is
you
this?
guys able to hear me now?
Kind of says I can hear you online, but
Yeah,
does that mean
okay.
you can hear us or you can hear Sam?
All right. Well, that's being worked on. Should we go ahead and move on into the director's report and Fadi's report? Should we move forward, Susan?
Sure.
Okay, let's go ahead and while the technical issues are being worked out, let's go to Fadi Yokohana. Added an extra syllable in there, I'm sorry. My vowels got ahead of me. Body
So we'll advance the slides.
to, yes.
For the
What slide down?
COVID update, which will be slide 40.
Slide 40, please. There we go. Okay. Gremlins.
Sorry, guys.
There we go.
Good morning. Happy to be here. Last time we met, I think the Broncos were still undefeated, so it's been a while and a troubling time there. I'm just going to be giving some high-level updates with some specific data points. I'll be happy to answer any questions if I'm able to. If I'm not, I can get back to it if it requires more detailed research. Some just high-level points. We're at, Chief Policy mentioned it, 71% vaccinated. That's folks that have had at least one shot, and 65% fully vaccinated. We breached that 70% mark about 3 weeks ago, which we're very happy about. What you're seeing on the screen right now is a very simple illustration of the incidence wave. The current wave that we're in is very different than the previous waves because it's staying there consistently at a pretty much a horizontal line. That's the right-hand side of the screen. We did hit a all-year high in terms of incidence on October. That was 342 per 100,000. And our incidence for the last 90 days has stayed within 50 points, and it's been moving along that line consistently. On the bottom part of the screen, you're seeing a 4-week shot of the cases per day. Sometimes when we talk about incidence, forget that means the number of cases per day, the folks that are positive per day. You're seeing a range between 300 to 350. Again, that's translating to a very consistent volume for the last 90 days. Next slide, please. This graph is showing our activity in terms of vaccinations. It's somewhat of a busy graph, but the takeaway point here is that the orange bars on the screen are folks getting the boosters. And what you're seeing is that more recently, more and more folks are getting their boosters than folks that are coming in for the first dose or completing their series. And that's normal. We were expecting that. We anticipate with the eligibility being expanded within the first week of November, our denominator is going to change and this graph will change because there'll be more and more blue, meaning more and more new people getting vaccinated, more and more new kiddos as they become eligible. Next slide, please. We are doing some projections. We anticipate that 10 to 30% of the eligible population of the 5 to 11-year-olds to be vaccinated within the first 8 weeks. That's based on previous age groups where we saw a spike and then a consistent volume of less, but a sort of the volume that followed that spike. So about 10 to 30% of the around 65 to 70,000 5 to 11-year-olds in our county here will be vaccinated within the first 8 weeks. That's consistent with national studies. The Kaiser Foundation updated their tracking of vaccine hesitancy and vaccine intake, and they are projecting about 33% of parents will vaccinate their kids right away. 33% will wait and see, and then 33% is in that group that's probably not going to get vaccinated. And that's consistent. The Kaiser Foundation has tracked vaccine intake throughout the pandemic, and their projections have been as close as anybody else out there. So we rely on them. Yeah.
When you're finished, I just want to offer some more details about
go
that. So we are anticipating vaccine supplies available for us to give vaccinations to the 5 to 11-year-old population on November 5th. So we have planned clinics already set up with our partners as well and the vaccine consortium. But with our new building, November 5th, the new building, as you guys know, that it's located in South Fountain, 6436 South United States Highway 8587. And then we are also offering vaccinations here at our Citizen Service Clinic, as well as on the weekend on the 6th and the 7th at the South location in Fountain, and also our Pikes Peak Park location, the Women's Infant and Children building over there on Fountain, I think it's Boulevard. So not the city of Fountain, but we are really trying to be strong out of the gate, as we have been when we have vaccine supplies, to provide locations throughout El Paso County. And so we are gearing up for that. And then I do hope that once the CDC reviews the information from the FDA, and if they give emergency youth authorization for that vaccine, we will be ready to go. We are also partnering with the Children's Hospital up north, but we know that not everyone lives up north. It's important to have clinics down south. So those will be evening clinics as well. So all of those details will be worked out. My main point is that we're going to be ready to vaccinate kids where parents are choosing to get their kids vaccinated, and working through that. We are also partnering with the Cheyenne Mountain Zoo to catch kids where they are. And Bob Chastain, he's gotten the okay, so we'll be offering a bus there. And this is not about vaccines, but we're working really to try to bring some additional supplies and opportunities for a treatment, the monoclonal antibodies. And I just got word this morning that we should have a bus at the Citadel on Monday. So there's a lot of action happening, and it's coming together, and we'll get the details out later. But my team is steadily working to, on so many different aspects of this response. And so that's just a little snippet of what they've been working on and what's going to be available as far as resources to the public.
And,
Sorry, I have a question. Susan, you've mentioned the mobile vaccine capabilities. How does that apply to, and I know we did a mobile vaccine clinic at Mitchell High School for those that were eligible and above that age. How does that apply once this 5 to 11 category opens up? If there are schools who want to have the mobile vaccination clinics on site, what do they need to do, and how does that work?
Thank you. That is another aspect where we have been doing a full court press related to working with the school leadership and providing those mobile vaccinations. So I've asked my team to push up that timeline, given what the school is ready for, with our mobile vaccination vans. And those are the health department's vans that we can deploy people to meet people where they are. But there's schedules with various different schools already to offer those 5 to 11-year-olds. I do think it is important to note that parent consent is also, part of that process. And we do prefer, especially with the 5 to 11-year-olds, that a parent or a guardian is available, because that's a different population. We will have vaccine for 5 to 11-year-olds at the mass vaccination sites, the Citadel and Chapel Hills, because we want to have options. But we do know that pediatrician offices, primary care offices, mobile vaccinations, Children's Hospital, working with, UC Health, Dr. Vu's operation, those are all options that will be available. So I think that's a really significant, great news for public health, because that's another tool for us to offer the community for prevention.
And our meeting today is very timely because last night around 4 p.m., the advisory board to the FDA and the CDC gave the approval. That's sort of the first peg in the dominoes to fall. They're basing their recommendation that vaccine is safe based on the trial data that tested it on thousands of kids, and they found out that the vaccine is safe and it's about 90% effective in that population that they looked at. I do want to mention, though, with the 10 to 30% projection, George Box, one of the most famous statisticians, said all models are wrong, some are useful. So the two caveats here is that the 12 to 17, what we're relying on as a comparison group, we're getting vaccinated initially without the presence of Delta as a dominant variant, and they were getting vaccinated without the school calendar being in effect. So those are two factors that might speed up, hopefully speed up that 10 to 30% projection within the first 8 weeks. Next slide, please. Our repeating graph, it shows the top 10 most populated counties, and We drew an arrow there just to illustrate the relationship. That arrow has been seriously consistent throughout the different variations of this graph. The higher you are on the graph, the higher incidence you have. The more to the right you are on the graph, the higher percentage of vaccinations. And right now we're seeing most counties in Colorado have an elevated level of vaccinations. El Paso County, again, has been stuck at that high elevated level. Now our ceiling is higher than other counties of similar populations because they are more to the right of the graph. At least that's the correlation that we make there. Next slide, please. We did want to include case demographics. So what we're showing here is a case incidence by age group. We divided the age groups for vaccine eligible to be, and the 0 to 4 group compared to the adult. What we're seeing here is that green line is the 12 to 17. Early August, they were getting hit with the virus or age groups in terms of incidence, not raw numbers, because the adults will outnumber the kids. Recently, the 5 to 11 have caught up, and the most recent week, they've taken the lead. We're seeing that the 0 to 4, thankfully, are much lower. The number on there, the county-wide incidence at that timestamp was 303. The 0 to 4 is at 168. The 5 to 11 and the adults are a little bit between that 303, a little bit above, a little bit below. Next slide, please. This slide is mimicking the incidence, except now we're talking about hospitalizations. We know that our kiddos are at lower risk of hospitalizations, thankfully. The graph is showing that the adult population continues to have majority of the hospital admissions, but it's not a zero-sum game, meaning that the adults are not 100% of hospitalizations. We are seeing hospitalizations among the younger kids, much lower rates, but they are happening. Children's Hospital has been in the news recently about their load, and some of it is COVID hospitalizations. They're dealing with other respiratory diseases, but we do want to mention that recently the hospitalizations among the younger kiddos is higher compared to the previous age group comparison in earlier times. Next slide, please. What we're showing here is a basic time snap of the virus in our community. The graphs may look like they're all the same, but the top graph is cases, middle graph is hospitalizations, and the bottom graph is deaths. Clearly, visually, if you just step back and look at this, what happens is every time the incidence goes up, hospitalizations go up and deaths go up. On that fourth box, that was our March to about July. Thankfully, the deaths did not mirror the hospitalizations and the cases, and we attribute that to the effectiveness of vaccines. Our 70-plus population got vaccinated pretty quickly and at a high rate. So what we saw, thankfully, is that we did not see the amount of deaths that we should see given no vaccines. In fact, just some brief numbers. In 2021, we saw 50 more cases a day and 3 more hospitalizations a day compared to 2020. But we saw half a death less every day. That's pretty phenomenal. It sounds half a death a day, not too bad, but when you multiply it by 300 days that we've elapsed in 2021, pretty quickly it gets to the market that we're in right now. One of the warning signs, though, is that that fifth wave, the deaths and hospitalizations are now starting to mirror the earlier waves, and the reason for that is because we continue to see elevated level of incidence around us. So the vaccination protection can only go far as the exposure. If the exposure is consistent and not only consistent but high level, that protection from vaccine is going to be challenged. Next slide, please. We're showing a screenshot that we include on our public dashboard. This is data that's coming from our regional hospitals. Every day they give us a number of load that they're seeing. On the right-hand side is the most recent time. Very troubling because that wave is starting to look like the November wave. In fact, it's about 60 to 70% of what it was in the November time, and it's not coming down. This has resulted in our hospital partners to come together with our medical director to decide that their hospital capacity is strained. They're limiting adult surgeries and procedures, and they're experiencing resource limitations. That's the specific language that is a consensus agreement among our hospital partners to describe their hospital capacity. Next slide, please. And Dr. Johnson is up next. Thank you.
Dr. Robin Johnson, Medical Director.
So as we look at those hospitalizations, and one of the things that I would say is that those hospitalizations reflect our incidence. Our incidence has been since August. at a high plateau. So we can anticipate that the ongoing hospitalizations and census will continue to track up in reflection of that. So this is somewhat different than what we experienced last year because of the sustained high volume in our hospitals over weeks to months. And as we look at, even if today we were to begin to see a decline in our incidence, it is going to take, it's going to lag a couple weeks in hospital incidence, or hospital census rather, and then we'll see a slower decline in that hospital census compared to the uptick. At least historically, that's what we've seen. So we can anticipate that the stresses on our hospital are far from over. And in fact, will be prolonged through November and potentially through December. Increasing if we don't turn this tide. So in speaking, looking at the Colorado Hospital Association internal staff letters that I receive, I am on staff at Memorial and at Centura, so UC Health and Centura locally, because I believe that as your medical director, I represent our community. To represent our community, I represent the agencies in our community. I am waiting to hear back on my credentialing at Children's. So I'm excited about that. I actually had enough CME to be able to do that. So it's an ongoing, nose to the grindstone. But these are the takeaways from those internal communications. Yes, sir.
Robin, you're also the president of the board for Peak Vista?
Yes, sir.
Okay, well, there's another feather in your cap, so thank you. Thank you for all you do.
No, so in those internal communications, as well as reaching out to our leaders in these organizations, these are the take-homes that they have asked for me to make you aware of. One is that this present surge is as severe as any that we have experienced in 2020 and 2021. And for them, it's more prolonged. It's driven by COVID-19, but in addition, we're seeing that there's delayed and deferred care that is occurring because of these need to reschedule our non-emergent procedures. And so when people do present, they are in more dire straits, and it is not ideal. It's not how we would want to move forward with healthcare. There's also ongoing traumas and the respiratory illness. Just we're moving into respiratory season, and we know that RSV has been really pressuring our children's hospital. There are staff challenges, and to Kari's point, 99.5% of UC Health in our southern region is vaccinated, 99.5%. It is really due to the burnout and moral distress, the moral distress of having to care for patients coming into a second year for something that is by and large preventable if we were to take vaccines. There's also threats that are occurring, personal and libel, and we know that in public health, and I'm sure you recognize that as public leaders. There's also this skyrocketing cost with just in the last year, 14% of increase. And many of our hospital staff are, I'm just going to put out there, they're being pilfered. They're being pilfered by other organizations back and forth, being pilfered by other states who are in dire straits. We're seeing that, and it's not just healthcare, although healthcare is the tip of the spear, we see it across the board in many other industries. They were just had a news report this morning about trying to get drivers for our snowplows this winter. It is continue to delay our elective procedures and surgeries. And if you're the one who needs your total hip or you're needing a catheterization to follow up on your stable angina, you don't want to be in this category. They're beyond the surge capacity. And so I think this is actually really key. I've always said the ER is a litmus test for what's happening in culture. It is also the canary in the coal mine to tell us what is happening in our hospital systems. They have routinely at Central 20-some people boarded in the emergency room. When you talk about that we're putting beds into the hallway or we're needing to move ICU patients out into non-ICU beds, it doesn't mean they don't get the vent, but they don't have the same eyes on them that they would in a large ICU facility. They're set up in particular for that kind of diligent observation, supervision, and intervention. So they are moving into these areas so that they can care for the people that are there, and they will continue to do that and absorb that. It is what we do in healthcare. We care for those who show up at our door. And consistent 12% or greater positivity in their tests within the hospital. So the burden of disease, remember, we talk about incidence and test positivity, demonstrate what is happening with COVID in our community. We have a heavy burden of disease that is continuing to percolate in the community. So next, please. So what is the local hospital doing in response to this? They wanted you to be really aware that they are working to optimize capacity. They are at incident command, and daily they are talking about which beds they can move to where and how they're going to absorb patients. And they are all of this to avoid divert. So when we talk about having your appendicitis and you show up and there's not a bed, that can happen. We've seen that happen in Denver. It has been reported in the news. This is something that they talk about daily, about how they're going to avoid that locally. And the reason to avoid that is it delays patient care. And when we talk about strokes or we talk about heart disease, time is tissue. That's kind of one of our mantras. Time is tissue. So we actually have stroke alerts that minute you hit the door, we start working on making sure that we're going to get rid of that clot, or we're going to treat that stroke so that we get you back functional, least impact from that. If we have to delay that to another hospital, that really impacts it, and it can be adverse to the patient. So there's a dedication from our hospitals to avoid that, but there comes a point where there's only so many resources. They are postponing non-emergent cases and are working with the state to find ways to try to shore that up so that we can move away from that. More than 98% of COVID patients are from Colorado. And they wanted to make it very clear they are not, while they are here for specialized care, they are very scrutinizing in these situations what care they do take, if that is care that they cannot be provided elsewhere. But particularly for COVID, 98% are from Colorado. We talked about medical necessity. They're incentivizing staff. They're really trying hard to find things to help keep them there. Most of the staff are having to work extra shifts, and they've been doing this for months, to some of them for the whole of the pandemic, picking up extra shifts. And if staffing gets lower or the patient volumes, let's say we have today 126 COVID patients across our hospital systems. That's only COVID. That is not accounting for the needs we have for cardiac, for ortho, for trauma, to deliver a baby. None of that's accounted for in those numbers. So those are extra patients. They have to be absorbed by the regular staff. And that means that we're changing our staffing ratios. So not only may I work a double as a nurse, but now I might have a 4-to-1 ratio, 4 patients to 1 nurse, or 6 patients to 1 nurse, rather than the usual 2. They are really working on innovation. They're advocating, helping us advocate for the monoclonal antibody treatments, which can help to prevent some of those hospitalizations, and particularly in patients who are unvaccinated. And then working on some remote patient monitoring so that they can hopefully keep people in home, and education, and then collaboration with other agencies, such as the long-term care facilities as a step down, or our homeless isolation shelter for those who might not have enough to go while they convalesce. They have asked that we really speak to the promotion and education for prevention, and they talk about this routinely in their systems. They talk about it routinely in the patients that they interact, but this is really the bread and butter of public health. That is why we are here. We are here to prevent, to promote, and to protect. And we do that through prevention with vaccination, wearing masks, getting tested. They are asking that we slow the spread of COVID. And then they are preparing, and there are ongoing conversations across the state of what it would look like for crisis standards of care and how that might have to be implemented. Next one. So vaccinations are really effective, and they, again, wanted us to have this message first and foremost, because it is what is going to prevent patients the vast majority of time from having to seek hospital care, even if they were to get an infection. Risk of serious of a disease actually far outweighs anything from the vaccine. It is the safest and best immunity. It helps us avoid serious illness, hospitalization, and death. We know this. Because of increasing pressure, we have seen a little decrease in the number of patients who are unvaccinated that are taking up the majority of those beds. Eventually, you have enough pressure, enough exposures. If we talk, we are, 10 to 12%, 1 out of 10 people that you interact with today when you go out in public will be carrying COVID and expose you. You interact with enough of them, go to a concert, you may be exposed to 10, 20, 30 people. We know unvaccinated people carry higher viral loads, more intense viral loads, are much more likely to transmit than those who are vaccinated. So that kind of pressure, it is really important to remember, vaccine is not an individual choice. It is a population health choice. Yes, it protects me, but it only protects me as good as Dr. Vu not coming up to me, he's vaccinated, so he's not transmitting it, even though Fadi might have had COVID, right? It is a barrier in that. It is 2 to 3 times more effective in preventing reinfection than, quote, natural immunity, which means having gotten COVID. You avoid also a disease process.
So is it the local numbers? Because I asked about that last month, about the local hospitalizations, or what is that from?
That is from multiple different sources across different studies. It is quoted in the CDC and in the New England Journal and Fadi. Do we have that locally as to reinfection? I don't know if we can pull that out.
We can provide a reference. We can provide.
Yeah, I can get a reference.
Brought that up last month.
Peer-reviewed literature, so.
Yeah, there was just a
We can
recent,
get you.
yeah, there's a recent article that came out in CDC, which
Thank you.
we are putting together that bibliography, so we'll also include it there. So it also avoids the disease process, which I have to tell you, COVID is a nasty player. It invades your cell. Its whole job is to hijack the factories in your cell for making proteins so that you can reproduce itself. Within that cell, it's going to make millions of copies of itself until it creates such pressure it bursts and kills that cell, releasing those viruses, which then go around into your lungs and bloodstream to your other organs to find cells to infect. So natural immunity, by definition, involves cell death, organ dysfunction, and scarring. We do not see that with vaccine, and that is key. It decreases fatalities, and we are well over 700,000 for the nation at this time from COVID. That's 2.2 per 1,000 people. And here in El Paso County, 1.5 per 1,000 people have died of COVID during this pandemic. The other ask that they had is that we truly seek out credible resources and sources of information. When we speak in public, people do listen. They take what we say and they run with it. Our greatest responsibility is to be a good learner and discerner of the data. We need to know where we are getting that and speak truth and speak fact to our communities so that they can make wise decisions. So next slide. I'm going to turn it over for the flu update, unless there are questions for me.
Dr. Johnson, just maybe one or two questions off that last slide. Isn't there a big study from Israel that says acquired immunity, natural acquired immunity is actually as effective or much more effective than immunizations?
So that is evolving, and there was, okay, so a small portion, and I mean, we can get into some of the details of what happened in Israel, because they had a portion of their population that was vaccinated early. And then when compared to the natural immunity, there is some conversation in that article as well about getting a vaccine on top of natural immunity and then length of immunity.
Okay, yeah.
As we look at actual studies that have been coming out, that was last May, as we've been continuing to monitor those kinds of studies, and what we're finding is that the antibodies that are made during natural immunity are quite variable, and that we can't count on there being effective immunity. The most effective immunity is from vaccine, and it is stable. We do know that there are boosters that are needed. When we get to this third booster, will this be a yearly booster like we see with the flu, or will this be a series like what we see with MMR? You know, we have a 3-shot series over several years for MMR to get the maximum immunity. We don't know that yet. And so there still is time for that to evolve. But more and more, the data is showing that the most effective immunity we're going to get, consistent and robust, is from vaccine.
Okay, Dr. Johnson, I'm going to call in time at this meeting and ask that we go ahead and head toward the executive session. We're going to be losing folks here pretty quick. Okay. So I think if you could maybe just wrap it up in a very short period of, you're done. Okay. Okay. Well, thank you very much. Okay, we're going to skip the flu update. We're also going to skip the, can we do that legally, or do we need to vote on the
We gotta
action
vote on the
items?
contracts, I think.
There's some,
The two contracts?
there's some action items that need to be taken, and I would just ask for Diana's advice, because we've got a 2022 budget
Okay.
proposal, which is really important, but that at a minimum is a 20-minute presentation. For the executive session, you know, I think it's gonna be tough to get through in a half an hour, which our meeting ends in a half an hour.
Yeah.
So
We
we
need to
have to
get
do the
through
action
these.
item, we do the best we can do. And
Let's do the action items, and the other update on budget, can we do that by email? Is that Diana? Diana, help us out here. County attorney. County attorney, we want to stay out of jail.
Good morning, everybody. Diana May, County Attorney.
Can't hear you.
I just want to make sure you guys can hear me.
Here we
go.
Yes. Susan, can you hear me?
Give us a sec.
Okay, this is pretty important. We'll wait for this.
Really painting Manny. Omaha.
Omaha. Yeah.
Omaha. Balls.
We need to have a code word.
Count to 10, Diana.
Can you hear me now?
Very little.
Very, very quietly.
Okay, I'll talk really loud. And get closer to my microphone.
But can I just offer my opinion that I think El Paso County Public Health is underfunded.
Well, how can I answer that? I have no response. If we had a set of drums here, there'd be a drum roll. No, seriously. Well, again, while we're waiting, public health has been chronically underfunded, and of the entire national health care budget, less than 3%, it's about 2.5% of that total amount is devoted to public health. The remaining 97.5% are devoted to clinical medicine. So nothing wrong with clinical medicine, but you're right. We do a lot with what we have.
I've been asked to try to talk again just to.
There we
We
go.
have our lawyer. Okay.
Okay. So part of it's going to be a little bit of legal and a little bit of the board preference.
Okay.
Does the board of health members have a hard stop, or can they go a little bit longer than our 10:30 time period?
We like to be able to tie this up at 10:30 because we know that board members have planned their activities around that. So I won't say it's a hard stop, but we'll be asking for a favor from the board members to remain.
So my recommendation, because these matters are all important, while not preferred, my recommendation would be to see if the board members would be able to hang in there for an additional 30 minutes till 11 o'clock. And I think we should be able to get through all the matters in that time frame, if that is something that the members would be willing to do.
If we are indeed brisk, let me go around the table. Who could stay until 11 o'clock? Thumbs up, thumbs down, we're good. Proceed. Yes.
So, at this point then, Susan, I think it's your preference on which you want to devote more of the time to, whether it be the items. I don't know if there's a way perhaps to cut back on the action items and do them quicker, or if you want to jump into the executive.
Let's approve the two contracts. We can skip the flu update and this preliminary 2022 budget presentation. Diana, I'm going to ask again, is that something that we can inform the board members of through an email, or do we need person?
We would need to post the meeting if we're going to do it other than in today's meeting, because it would be an update that Susan needs to do. So my recommendation would be to vote on the contracts, and then Susan, would it be possible to abbreviate the budget presentation?
We can ask Sam if she can, it's a pretty thorough presentation, so if she can maybe give us the bottom lines related to 2021 and.
Why don't we do both? Let's ask her to, I think we solved our technical problems. Let's ask her to give us the bottom line up front and then supplement by email for board members, okay, for them to be able to look at and count the numbers. So thank you, Diana. Let's proceed to the bottom line up front, preliminary 2022 budget presentation. Please, Samantha.
Hear me this time.
Yes.
Yes.
Okay, so we're going to really abbreviate this, and I'm going to kind of skip through all the way through to the last set of slides. I believe this is in your board packet, so you guys have the entire presentation.
We do.
So there are just a few things I do want to go ahead and highlight. One would be the critical needs that Susan did address and present to the Board of County Commissioners. This is part of the 10 positions. It's part of a 5-year roadmap with the Board of County Commissioners to increase some funding and support for the Public Health Department. We would like to thank the Board of County Commissioners.
I'm sorry, what slide are we supposed to be on?
Sorry. If we can jump to, trying to get it, slide 19.
Slide 19.
And then we'll do some more jumping really quickly afterwards too.
Okay.
Oh, I lied, I'm sorry, slide 18 or 20.
Slide 20. Please.
Okay. So what I'm going to talk about, because my slide numbers are off, so I greatly apologize, is the 10 critical need positions. It's part of a 5-year roadmap that Susan, I know, has been working with the Board of County Commissioners to fund. In 2019, they did approve $200,000 of ongoing funding for you guys. In 2021, there was an additional $250,000, so a total of $450,000 of ongoing funding. This year, I know Susan has gone to the board and requested an additional $150,000 of ongoing funding to get closer to that 1 million. So just some things to be aware of that is in the roadmap. We will find out later in November which is all approved or was not approved. All right, next slide.
Next slide.
Next slide. So these are the 10 positions I was just speaking about. Next slide. Next slide. So a lot of this 2022 budget, there's been quite a bit of increases. The increase for revenue is mainly one-time grant funded due to the COVID pandemic. And a lot of these funds, all of these one-time COVID pandemic funds are specific to COVID and are very time limited. So these funds will be ending. Let's go with next slide. Next slide. Trying to hurry, guys. The next slide. So this is the critical needs support I was just speaking of. So next slide.
This is hard. This is hard, isn't it, Samantha? About that.
Let me make a comment that I think is
Yeah.
important. For the additional ask to the Board of County Commissioners for 2022 of $150,000, you can see on slide 26 of your packet that the Board of County Commissioners approved funding for us in 2019. You all approved funding from our fund reserve. So this 5-year plan, we go back to the county commissioners and ask for increases every single year as part of the 5-year funding plan. And then we ask your permission and support to use fund balance to continue to maintain the 10 critical needs positions that we currently have. That's gained us in the community, our data analytics office, and this goes way beyond COVID. Public health nurse, if you remember, we had less than 5 full-time nurses for our clinics, and this nurse has been critical because we've assumed additional responsibilities, for example, in COVID with outreaching to all of the long-term care facilities. We've got 2 youth health and wellness positions, which are critical to teen suicide prevention. We've got 1 administrative specialist, which is critical to streamline our processes and provide us support, and especially as we are going through remote, shifting and a continuity of operations. We've part of that is the 2 environmental health specialists. The demands are increasing all over the community. It's counterintuitive going through a pandemic and increasing retail food establishments, but that's what the situation is in El Paso County. Also for on-site wastewater systems, we issue the highest number of, one of the highest numbers of permits in El Paso County. So all of those positions are critical. So we're not increasing those positions with the county ask for critical needs. We need to maintain it. And I would also say to Dr. Wu's comment that local public health is underfunded. I agree wholeheartedly. I've been in this career for 20 years and we're always doing more with less, but I would also say too that we do a lot with what we're given. We're their first accredited health department and this is a really high performing agency. I spoke last time about this is unsustainable. I mean that. We have to maintain our staffing. So this is one portion of it, but I just wanted to make that point so it makes it clear that we're doing the best we can. We're grateful to the Board of Health, your support for the using the fund reserve, and then the county commissioners as well. We need that support. And this is a work in progress to maintain our staffing and, take every day, week, month as we go. But currently, if we're not sustaining some of our staff, and this is for future, when we talk about burnout and all of these aspects, it's not sustainable. It's not sustainable for me. It's not sustainable for my staff. So that's just kind of the point that I'd like to sum up Yes, we've got grant funding, but that's time limited. So that's, I think, an
Okay.
important piece.
Well, board members, yes, approval of the budget is one of the key tasks that we have as a Board of Health. And I certainly don't want to give this short shrift or make it seem less important. Sorry, you had a comment?
Yeah, I know we're trying to get through fast, but and Dr. Wu's comment,
Yes.
I think if you go back to page 12, slide 12, and this has been consistently since I've been on the board, nearly 10 years now, that we are well below the national average as far as staff, how many staff there are. And I agree with Susan that they do a phenomenal job with what they have. It's really unbelievable. But I think COVID has highlighted, like it's highlighted a lot of things, that it's not sustainable. So I don't want to hijack us in any way, but we've got to figure out how to get more staff in this department. And I don't think that's going to be answered right now today, but I just wanted to add on to what Dr. Wu said. It's underfunded, and I see that there's a plan. There is a little bit of a plan, but I really feel like it's our responsibility as the board to make the department sustainable and so that it can answer the needs of the growing population. I don't have an answer for that, but could we have that on a future agenda perhaps?
Yeah, for sure. And I had the opportunity to attend Susan's presentation for the Board of County Commissioners. And one of the takeaways for me was that given the current environment, it's very hard to hire people, and especially to find good people. And as Kari mentioned, sometimes our really good people get poached. But I think long-term, we need to get up to that number that we've talked about so many times, which I believe is 259. Is that the number?
269.
259, okay.
Yeah, I mean, I'd like to go
69.
into a lot more depth about staffing. I mean, I have ideas on how board members can support.
Okay.
Yeah, do we need to lobby the state? What can we do?
Yeah, I mean, that's another aspect too. I mean, the state per capita funding is around $948,000 usually for local public health, but with a population our size, that's inadequate for core services. And so we have been working on public health transformation, and we have been successful, and you'll see this in your packet, to get a little bit over $1 million for 3 years in state per capita funding. However, we have not received, I think it was official word maybe yesterday, on that, and that's a state fiscal year. So that money's now they've approved our categories, but what month is this? October?
Yeah.
So it's November, December, January, February, March, April, May, June. So we've got 8 months because that's on the state's fiscal year and they have different requirements. After that, it's going to be general fund, and they're doing it on a population basis, but that's for 3 years. And I would recommend that we connect with our state legislators, and we need to sustain that funding because that would sustain some of the staffing, that the core public health staffing that we need, not only for COVID and emergency response, but as you talk about, there's emerging diseases. Demands are increasing throughout our county, and we're a service organization. We need our team, and we need them not to be burnt out and stretched so thin. And so that's one idea that I have, but there's a lot, I think, for us, and these meetings are always jam-packed and there's so many priorities, but I think we would need more time to have some discussion.
Well, many boards have committees. So far, we don't. We have been able to get by as a Board of Health without committees, but I think I have the sense of the Board of Health is that maybe it's time that we, the board members, assist Director Whelan and her staff with a strategic plan to aim for the 269, and that I'm looking for 3 volunteers.
Well, and I think we need 2 because if we have 3, it's a quorum. So Kari, I know you have interest.
2, okay. Okay, it looks like Fire Chief, Kari, and count me in. Okay?
And I I realize I have not made a friend here today with Mr. Donaldson, but I wonder if.
I'm your friend.
Well, thank you. I wonder if the city could be a partner. I don't know if that's traditionally done with health departments, but if.
Oh, that would be part of the strategic planning, wouldn't it? Let's get together as a committee, come up with some aspirational goals, which could include what you just mentioned, and then at a later date, with Susan's help, present it to the board, and then hopefully it'll be actionable at that point. But here we go. We've got our first committee. And what are we going to call this committee? Staffing? No.
Funding.
Funding.
Public health infrastructure funding.
Yeah, okay.
I mean, what would you call it? Budget.
Budget or strategic planning.
Strategic
Something.
budget.
I like strategic planning.
It is really
That doesn't tie our hands exactly.
Exactly.
We're gonna have a strategic planning committee, okay? And we'll work offline to come up with the date and the location. Okay.
Yep, that sounds great.
Okay.
Sounds great, and I'm thankful for the reminder too about city, because health departments are all set up so differently.
Susan, anything else on this balanced budget? Oh, Varchi.
One question, Susan, I may have misunderstood you, but please help me out with this. Did you say that some of those positions were going to be funded ongoing from the fund balance? And if so, how sustainable is that? For what length of time are we looking at?
So we do have, maybe Sam, what is the slide for the fund balance? We're currently, we're at 28% of our fund balance, and it's definitely not sustainable. But your policy for the Board of Health is to have it between 18 and 21% for the fund balance. But in order to make this work, to get to the long-term funding goal, to maintain the 10 FTE and to equal $1 million additional funding from the county, the strategy was to use the fund balance as part of that 5-year roadmap, incrementally, to get to the $1 million with county funding.
So you're wanting
Using.
slide, I believe, 12.
What's that,
Slide 12. The fund balance slide.
I believe that is slide 12. And the overall plan was to utilize fund balance while we were waiting. No, sorry, slide 15. Slide numbers are kind of a little off.
Doing a good job.
Thank you for your flexibility, everyone.
I appreciate that, guys. Sorry. So as of 2020, you guys were able to increase your fund balance by about $2.7 million. In 2021, we are budgeted from the original adopted budget to decrease it by about $860,000. And in 2022, the preliminary balance budget is to decrease it by about another $280,000. Again, as the critical needs are approved with the El Paso County Board of Commissioners and the funding is increased, that should help offset that as well.
And I would just note that 2020, 2021 have not been really normal years related to the funding that we're receiving for COVID. And then also we've had to close programs and reduce services. So our funding there's a lot of just different dynamics that have gone on for the past year.
I would also say that the Board of County Commissioners have been exceptionally generous and have always been there for us when we needed it. So thank you.
I would second that. Give credit where credit is due. They definitely pulled through.
Yeah, absolutely.
Yeah, they made us a priority for the CARES funding and also the Arpa funding.
Yeah.
And that's been very appreciated.
Noted. Okay.
So
Anything else? Pam?
can we jump real quick to slide 27 or 31?
Which one do you want?
33. 34?
Okay,
I apologize. Slide 34 real quickly.
you're doing great.
Thank you guys so much for heading in. Can I hit the next slide? Okay, so this is your 2022 preliminary balanced budget. We are comparing it on this slide to the 2021 adopted budget. On there, you can see a few things I just want to point out real quick is the Paso County ARPA funding, like Susan just mentioned. Paso County has given public health an additional $1 million of ARPA funding, and that's where you're seeing that $1 million increase right there from 21 to 22. The state funding, like Susan mentioned earlier, was giving an additional $1 million that we had a very limited time to spend in. And so we've put that already into the budget for 2022. That's where you're seeing a lot of those increases. Overall, once everything is kind of taken into consideration, like we had just mentioned, the 2022 preliminary balance budget is currently predicted to eat into fund balance by about $286,000. The critical need that Susan had requested from the Board of County Commissioners, El Paso County Board of Commissioners, is not built into this. So that would be some changing should that be approved. That would also be added on into this. Any questions overall?
Questions from board members or comment? Yes, Commissioner Bremer.
Sorry to belabor this. No questions of Samantha's thorough and concise presentation, but back to the previous topic about a committee, I actually think that what I'm just going to throw out an alternative suggestion, and that is maybe that all of us are involved in a work session with the budget team. Because we're a fairly small board anyway, and I think this is very fundamental to the direction we all want to head. I also don't want to tie our executive director's hands and feel like we're micromanaging her budget. So I feel like a work session where we try to help get what's needed with the whole board is probably maybe the better way to go. And with Samantha and budget staff, with Susan's kind of proposal put together ahead of time, I think that might strike a better balance. And a work session just simply means we notice it as a public meeting, but it's just a work session for working through a specific
I think
thing.
that's a good idea, but I like the idea of a strategically focused committee, and it may end up being a standing committee, and it includes more than just the budget. It includes staffing. I think it could include Public Health 3.0, some of the ideas from that document. And so I like your idea for a work session to look specifically at the budget, and that would be something that we could also conduct either in person and or remotely. But I would like to keep the idea of a strategically focused committee, Kari, Ted, and myself, and perhaps then bring it back to the board with some other ideas. Zed? Yes,
Another,
please.
I guess, consideration. Diana, if there are 3 members of the board, then it has to be noted as a public meeting.
Mm-hmm.
Help me understand.
Yes, and a committee, pardon me, if you have, pardon me, 3 or more, we would, but that could also be, like Commissioner Bremer suggested, a work session, or if we have a committee, a subcommittee that you decide to create, we would need to post like we do with our board meetings.
Okay, well, it sounds like we decision. Commissioner Bremer, sounds good. Work session. Let's do that, and we'll talk about budget to start with. But I'm gonna hold in abeyance this idea of a strategically focused committee because I like it. I'll bring it up again.
And I would say too, I mean, I can reach out, also, I mean, Kari's, called me and emailed me and, on the same topic. And I can stay connected. Also, we have been working on this.
Okay.
It's just that, COVID's been dominating much of what we do, but we are in the process of, strategic planning with our indicators report, our community health improvement plan. That all goes to staffing as well. And so we're putting that information together. So what I would ask is that, that let's take some time and really be thoughtful about, what the future looks like, and really kind of, pick that apart related to what that looks like for our community. Because, there's a national average, but then there's also assessing what we need and what that looks like.
Okay. So my understanding is that within the next month, there will be a meeting of this work group to talk about budget and other topics, and any Board of Health member who would like to be part of that is welcome. And we may choose to meet here, but we will also provide an opportunity for people to participate virtually. Okay?
And then, may I have another request?
Sure.
It's 5 minutes till 10:30. Can board members stay late so we can have an adequate?
We did that.
Oh,
We got-
sorry. Oh, sorry.
We got mine.
We got a
Oh,
hall
okay. I was
pass to
out.
go
Okay.
to 11.
Contracts.
Thank you.
Yeah, got it covered. Okay, now we need to do contracts. So let me jump ahead here. And Samantha, what do you want to tell us about these 2 contracts? I think we've seen these before, haven't we?
So one of them you have seen before, however, the drug-free communities youth substance prevention
Okay.
in Fountain Valley is a new contract. It's $125,000 a year, and it's to target marijuana and prescription drug opioids among youth in the area. Do you guys have any questions on?
Board members? Okay, go ahead.
And the other contract, the Wic contract, is a renewal with a slight increase of just under $63,000.
Okay. Board members, you have it in front of you. You have had a chance to look at it. Any questions or comments? If not, I would accept the motion to approve.
Move approval of both of these contracts, youth substance use prevention program and the WIC.
Okay. I would allow that because we've seen WIC before. Any changes to the WIC contract? Sam?
It had a slight increase, but programmatic changes, I would defer to Brenda or Melissa.
Melissa?
This is Brenda Heimbach, and there were no programmatic changes or scope of work changes.
Thank you. Thank you, Brenda, because this looks pretty familiar and is absolutely essential to the work of the Public Health Department. Okay, so the motion on the table is to approve the drug-free communities contract and the WIC contract, which we've seen before. Any further discussion?
I don't know if we had a second, I'll second.
Second, we have a second, a motion and a second. All in favor?
Aye.
Okay, here we go. Should we take a little break as we get ready for the executive session? How about we do that? Might be it's a kind of a public health thing to do, isn't it? Go.
Dr. Turbish?
Yes. Uh-oh.
Sorry.
What'd we do?
No, you didn't do anything. I just, perhaps to make it a suggestion, since we're just a little pressed for time, my recommendation would be, since the executive session's the only thing left, that I read that into the record. You call for a vote on the executive session. We would need to clear the room of anyone who's not authorized to be present, and then it would give you guys a chance to take your break, and then we would log into our private session for the executive session. I think it might save a little time if that might be amenable to you.
Okay, you know what? You've actually provided me a script for that, and I just jumped right over it. So we're going to need a motion to enter into executive session. In-person attendees who will not be included in the session should leave the room. So that's the majority of y'all. Fadi is welcome, Haley is welcome, and Dr. Johnson will stay. And that also Vicky's going to need to stay to manage the teams and run the slides. And it concludes, we'll go back to the regular teams meeting. We'll need a motion to go back into our regular meeting. Yes. Yes.
Turbish, might I say we do need to include public comment? Can we move item number 9 ahead of item number 8, take public comment now, go into our executive session and...
I think that's a grand idea. Do we have any members of the public who would like to comment at this meeting?
We have no requests for public
We have no
comment.
requests. Okay, public comments taken care of. So I need a motion to go into executive session.
So moved.
Second.
Okay, pursuant to CRS 246402, the County Attorney's Office is requesting an executive session with the Board of Health regarding Colorado Department of Health and Environment public health orders and guidance implemented in response to the COVID-19 pandemic, to include legal advice on specific legal questions related to COVID-19 guidance for schools. That's the reason for the executive session. All in favor?
Aye.
Any opposed? Okay, let's take a break. October, adjourned.
Total is going to be 75%.
Really?
Committed 11%.